we are covering the out-of-pocket maximum, sometimes called a stop-loss provision, a critical concept you will face on the health insurance licensing exam. This is the absolute most an insured person will pay for covered, in-network healthcare services during a policy year. Once this limit is reached, the insurance company pays 100% of all covered costs for the rest of the year. For exam purposes, the terms out-of-pocket maximum and stop-loss are often used interchangeably to refer to the insured's spending cap. Let's walk through an exam-style calculation. Imagine an insured has a policy with a $2,000 deductible, an 80/20 coinsurance provision, and an out-of-pocket maximum of $10,600. The insured has a covered hospital bill of $52,000. First, the insured pays the $2,000 deductible in full. This leaves $50,000. Now coinsurance applies. The insured is responsible for 20% of this remaining amount, which is $10,000. At this point, the insured has paid $2,000 for the deductible and $10,000 for coinsurance, for a total of $12,000. However, their out-of-pocket maximum is $10,600. Therefore, the insured's total payment is capped at that $10,600 limit, and the insurer covers the rest. Once that maximum is met, the insurer pays 100% for any other covered services for the remainder of the policy year. The exam will absolutely test you on what counts toward this limit, and more importantly, what does not. The items that count are the insured's payments for deductibles, copayments, and coinsurance for essential in-network health benefits. The biggest trap on the exam involves the things that do not count. Monthly premiums never count toward the out-of-pocket maximum. Also excluded are costs for services the plan doesn't cover, like elective cosmetic surgery, and any amounts billed by out-of-network providers. If a question mentions the monthly premium, you must ignore it for the calculation. Under the Affordable Care Act, plans have a maximum out-of-pocket limit, which is adjusted annually. For 2026, this limit is $10,600 for an individual and $21,200 for a family. Family plans have an important rule called an embedded individual out-of-pocket limit. This means that no single person in a family plan will ever have to pay more than the individual maximum for that year. Here is a simple phrase to help you remember the most common exam trap. Premiums are the price to play, not part of the pay. This mental shortcut helps separate the ongoing cost of having insurance from the cost-sharing amounts you pay when you actually use covered services. The out-of-pocket maximum only limits the amounts you pay when you use the plan. For free practice questions, AI-powered explanations, and more exam prep tools, visit openexamprep.com. That's openexamprep, all one word, .com.